So in the UK system has allowed us over the years to increasingly try and lobby and try and influence, because healthcare is such an important issue. And although ideally it should not be politicized, it is politicized, and therefore it becomes of great importance to governments, to the civil service, to the Department of Health. The key for the British Hip Society has been establishing a very strong base and validity to the leadership of the society, such that it represented its members. And therefore, by doing that, notably with the metal issue, but with other issues such as thromboembolism, we've been able to speak as a voice for our membership. And therefore, we've been able to do that consistently. And so policymakers and governments have started to listen to us. The way this has worked has been very gradual. It's been a very slow erosion. But the reality is now that whenever there is a guideline, whenever there is information to be given, whenever there is discussion around data, we are increasingly finding ourselves at the table and able to give a view. And when you begin, you are one voice at a very big table. But if you're a voice that has data and has strength and support of your membership, then that voice becomes prominent, because the others around the table have to accept that it is the most relevant voice to talk about hip surgery. And so we have been very fortunate. The traditional model in the UK has been that the Royal College of Surgeons has spoken for surgery. The British Orthopaedic Association has spoken via the Royal College of Surgeons for orthopaedics. And the specialist societies have hidden below that and fed up through it. The reality is that by being very clear as to what we want to say, understanding both what our members want and actually understanding the data coming out of our members, out of their practices and out of their patients, we've been able to sit at the table and hence start to have an influence over the next generation of documents that will guide practice. But it's a slow process.
Yes, it is, and it's very important for the future from different point of view. Also, very simple point of view, reimbursement of procedures. Sometimes you have the same reimbursement for very complex cases and very easy ones. But on these topics, the society should have the possibility to speak with authorities. Otherwise, the surgeons doing the most severe cases can be penalized by this. So there is so many things, the developing of the registry, as they have done, for example, in UK, with some limitation, because sometimes maybe that the health authorities are too much strong on that, have too much power on that, and it must be discussed with the scientific community. But it's very important. It's the future collaboration between scientific society and health authorities, yes, for the patients.